Do you have eye bags or do your eyes feel like they're sunken? Well, we can help immediately with tear trough filler. And that is what we are going to do today on our patient. So I will show you how simple the procedure is. I've already put in a little bit of lidocaine right here. You can see there's a little white area because it's lidocaine with epinephrine, so it helps squeeze the blood vessels shut so it decreases the risk of bruising. So I'm going to just see, let's grab a little alcohol swab. I'm going to make sure that you're nice and numb. Are you numb here? You feel that?
Mm-hmm.
You do feel that?
Just pressure.
Okay, perfect. Okay, 1, 2, 3, 11, 10. So we're going to make just a pilot channel for our cannula. And I like to use a cannula for tear trough fillers because there's no needle at the end of it. So a lot less risk of bruising and complications that way. So I'm going to go in through my pilot channel right there. And just travel underneath the skin. Now open your eyes and look up for me. Great. Okay, you can kind of, let me know if I irritate you. There shouldn't be any discomfort with this. All right, and now I'm going to put some filler in. Here it comes. The filler does have lidocaine in it as well, so your eyes might feel a little numb for a little bit of time, for an hour or so afterwards. We're just gonna, I've already done a little cheek filler here because cheeks are always the scaffolding. When you raise the cheeks up, it helps with tear troughs. I'm sorry. So I always like to start there. And then if we do a little cheek and then you still have some volume loss, then we do some tear trough filler. So you doing okay?
Mm-hmm.
Does it feel weird?
A little bit.
Yeah. Tolerable?
Mm-hmm.
Oh, we're just gonna put some small threads in there of filler. This filler can last for a year. Tends to even last a little bit longer just because you don't move your tear troughs very much. Although you may smile a lot, your tear troughs under here don't move as much. So it tends to last even a little bit longer than what the manufacturers say is the longevity of the filler. This filler is made out of hyaluronic acid, which is something we have in our skin to begin with. We just also have an enzyme, that eats it up as well. And we don't, as we age, not that you're old, but as we age, we don't make as much hyaluronic acid and we still have that darn enzyme. So our spongy skin becomes a little bit less spongy. So we're simply replacing hyaluronic acid. And you know, you'll see on commercials a lot too that people talk about the skincare products always. They're always like, oh, 2% hyaluronic acid or whatever in the skincare because we want that sponginess back. It's very hydrating. And again, a very natural thing to have in your skin. You doing okay?
Mm-hmm.
Okay. So you can see already compared to the other side, she's going to be a little bit swollen, but that's okay. So now we're going to go to the other side and do that. Okay, hold on a sec. We're going to travel. Let's see, 0.4. So not a whole lot of filler needed. I always just do 1 syringe for tear troughs, and then I have people come back. Can you feel that?
No.
Okay. So you never want to overdo filler. So might as well go slow with it. All right, so cannula. It's going to go through my little channel, and we're going to scoot right under there. Scoot, scoot. And there are different fillers for different areas. This particular filler is good for tear troughs. It would not be good for cheeks. Cheek filler would not be good for tear troughs, but it's good for cheeks. So you don't need to figure out which filler is good for where. That's my job, or your injector's job. So don't get overwhelmed with figuring out names and places. Just make sure you find a provider that knows what they're doing and can pick the correct filler for the location you want it. And you could see it really nice. I do like going laterally here because I think it just helps lift everything too. And you see how nice and gradual. And with being a cannula, there's a really low risk of me bruising her because there's no needle point at the end of this, at the end of the cannula. It's just a blunt tip. So the risk of bruising and other complications is much lower when you have a cannula. Also, as I slide underneath her skin, I am irritating her skin cells just by using the cannula, because it's not a needle, it's not going right through. And as I irritate her skin cells, they'll kick into high gear and make more collagen. So this particular technique will make you make collagen. It's also important, if you are doing tear troughs, make sure you go to somebody that does a lot of them, because tear troughs can be very tricky. So you can see nice result. And like I said, it can last for a year, it can last a little longer than a year. Let's see, I think I'm going to keep going. It's also important to have good eye cream. Do you have good eye cream? Mm-mm. Okay, all right. So we're gonna make sure she's set up with some good eye cream too at the end of this. Let me come back over here just for a sec. The reason why people get dark circles under their eyes is because this area is very thin and you're seeing actually vessels and the blood flow underneath. So when you put filler under the skin, it helps those dark circles because it essentially thickens that area. So your thin skin is thicker skin now, and you can't see those vessels and the blood underneath as well. So that's why dark circles happen. And that's why filler can help with dark circles, but that looks really great. And that felt okay?
Mm-hmm.
Yeah, no pain?
No pain, just you can feel pressure, but no pain.
Yeah, this is kind of weird, isn't it? Yeah. But anyway, if you have eye bags, if you have dark circles, if you want to find out more about tear trough fillers, let us know at RejuvenationMD. If you enjoyed this video, please share it, like, follow, subscribe, and most importantly, come and see us.